Throughout this video, we will be following the diagnosis of a 34-year-old male named Gary Simmons. On April 17, 2017, at 4:30 p.m., Gary Simmons experienced extreme flu-like symptoms such as fever, chills, nausea, and diarrhea. This went on for a few days until Gary drove to the doctor's office to see what was happening.
I'm on my way to the doctor's office.
On April 21st, Gary arrived at UC Health Emergency Room in Colorado Springs.
Gary Simmons? Follow me. How you doing today, Gary?
I'm not feeling too great.
Okay, well, first we're going to take your height, so make sure your heels are against the wall.
Okay.
Okay, very good. And now we're going to take your height.
Sweet. How tall am I?
Oh, you're about 6'1". That's pretty good.
Oh, great.
Okay, next we're going to take your weight.
Sounds good.
Looks like you're about 175 pounds. So explain to me what's been happening to you.
Well, I have fever, chills, nausea, and stomach issues. I'm just not feeling too good overall. It just started about 5 days ago.
Okay, well, to start out, to figure out the cause of your symptoms, we will take a few simple diagnostic tests. I'll take your blood pressure, your heart rate, your temperature, and I'll listen to your breathing.
Okay, sounds good.
Okay, breathe in and out for me. Your tests seem pretty normal. 125 over 82 blood pressure, normal heart rate, and your breathing sounds good. You do have a slight fever with 101 degrees though.
Yeah, I've had that for a few days. It's not too fun.
I bet we're going to analyze your tests a bit more, but I have a feeling that you just have the flu that's going around. Dr. Rodriguez will be with you shortly.
Okay, thank you, Nurse Josh.
Hello, Mr. Simmons. How's it going today?
If I'm gonna be honest with you, Doc, I'm not feeling too great.
Looking at the notes here, you seem to have some chills, nausea, and stomach issues. Is that right?
Yeah, it really sucks, and I haven't been able to go to work for a few days.
Well, your tests were pretty normal. There doesn't seem to be anything wrong.
Is that a good thing, or does that mean you can't diagnose me with anything?
It's perfectly fine. It seems you have the influenza virus. Just some rest and lots of fluids will help it. You should be better within a week or so. I will also prescribe you some over-the-counter anti-inflammatories, and throat lozenges to make you feel a little bit more comfortable. I don't think there will be a need to come back.
That's what the nurse said as well. Thanks, Doc.
A few weeks later, Gary's flu symptoms became more normal to him. He still wasn't feeling as well, though. He put his flu symptoms aside and started to go back to his normal life until one day he noticed he was having terrible joint pains and his joints were swollen.
Oh my goodness, I can't move my legs. Gosh darn it, another trip to see Dr. Rodriguez, I guess.
Good to see you again, Gary. What have you been up to these last few weeks?
I've kept myself busy by reading my hunting magazines. My flu sickness is pretty much over with, but now my knees are hurting, so I won't be able to go hunting anytime soon.
Oh, so you like to hunt. Do you hunt often?
Yeah, I love to hunt. I hunt with my brother on an annual hunting trip to Minnesota.
So, where in Minnesota do you guys hunt?
At my cabin in northern Minnesota, by the Boundary Waters. It's right by a lake, and it's surrounded by a beautiful forest.
Wow, must be a lot of disgusting bugs. I couldn't handle all that.
Yeah, there are, but we use bug spray, so it's not too bad.
Sounds like fun. Dr. Rodriguez will be with you shortly.
Anyways, how are you feeling?
Pretty terrible. My legs hurt, especially my knees, and I can't seem to bend them without a ton of pain.
I may have an idea why you're so messed up.
Well, what is it?
Do you have a family history of arthritis?
Yeah, my uncle had arthritis. Don't you dare tell me that's what I have.
I'm afraid you might, because it's very common to get passed down from generation to generation. To get definite results, I'm going to have an MRI on your legs. Mr. Simmons, I'm sorry to say, but you have arthritis. The radiologist confirmed that you do by the inflammation caused in your knees. I'm going to prescribe you some ibuprofen to help the pain and reduce the inflammation.
Okay, will it go away?
Not likely. It is usually sticks around. It'll just be more mild with the painkillers.
Okay, thanks anyways.
Anytime.
A few weeks later, Gary noticed that his face was drooping on his right side. He noticed this when he was in his bathroom getting ready for work.
What in the world is going on? My freaking face is drooping. Oh God, I gotta see Dr. Rodriguez again.
Oh my, what happened to your face since the last time you came in? Did you take your medicine?
Yeah, my face is drooping. My knees still hurt. And yes, I took my medicine. I took it every day like you said.
Well, I guess we're dealing with something a little bit more complicated than arthritis. Based on how you've been feeling and the symptoms I've seen last month, the pieces are starting to come together. Have you been to the Midwest or Northeast in the past few months?
Yeah, I was hunting in Minnesota. I told your nurse all about it.
I'm going to set up an enzyme-linked immunosorbent assay with the phlebotomist. If that is positive, I'll set you with a Western blot test to see if there's any antibodies to a specific bacteria in your blood that you may have gotten from your hunting trip in Minnesota.
Okay, sounds good.
Alright, Gary, now we're going to do an ELISA test. This is going to test your blood and see if you have antibodies for the Borrelia burgdorferi bacteria. Well, Dr. Rod, it seems that the Borrelia burgdorferi bacteria was present in his blood, as you can see right there. So I'm thinking he does have Lyme disease. We're going to have to do another Western blot test to figure out if he has it, but it was positive.
Okay, I'll prescribe him some doxycycline if he does. We'll get this figured out.
Alright,
Thank you.
no problem. Yo.
Now we have come to the conclusion that you have Borrelia burgdorferi antibodies, which means that you have the bacteria that causes Lyme disease in your blood. Lyme disease causes drooping in the face, which you had on the right side of your face, and it also causes flu-like symptoms, which you also had, and arthritis in the knees and other parts of the body.
Oh my gosh, I had Lyme's disease this whole time?
My guess is that you're bitten by a tick when you went hunting in Minnesota.
Come to think of it, I do remember having a tick. I just didn't think anything of it. I wasn't really aware of the disease and I didn't see a rash or anything.
Yeah, rashes are usually a common symptom, but they don't always appear to be present. But I'll give you a doxycycline dose for the next 28 days, and you need to take it 2 times a day, and it should clear up your Lyme disease symptoms.
Darn. That kind of sucks. Thanks anyways, Doc.
No problem.
Gary took his medicine and his symptoms gradually subsided. Because Lyme disease was not common where Gary was from, he had no idea what it was, and it never crossed his mind. Sadly for Gary, his infection was caught so late that Lyme disease progressed very far. Because of this, he will have permanent nerve damage in his face and will likely have arthritic pain throughout the rest of his life. And now we're going to be looking more in depth at Gary Simmons' case file and how he was diagnosed. Also, we'll be looking more in depth at what Lyme disease actually is.
Gary Simmons is a 34-year-old male who stands at 6'1" and weighs about 175 pounds. He lives in Colorado where Lyme disease isn't common, but he takes an annual hunting trip in Minnesota. Some of his symptoms included vomiting, fever, diarrhea, joint pains, and nerve damage.
First, Gary Simmons experienced vomiting, diarrhea, and fever, which is stage 1 of Lyme disease. Some diagnostic tests were performed, and it was concluded that Gary had the common flu. Next, he experienced joint pains, which is stages 1 and going into stage 2 of Lyme disease. An MRI test was performed on his leg, and it concluded that the patient had mild arthritis by looking at his knee joint. Finally, Gary experienced nerve damage in the face with the drooping of his face, which is stage 2 going into stage 3. Then blood tests were performed, and it concluded that the patients had the Lyme disease bacteria. Stage 1 is the appearance of a bull's-eye skin rash. Arrhythmia or migraines usually develops about 1 to 2 weeks after the bite, but it may not be detected or show up at all. And there is flu-like symptoms, joint aches, fever, general fatigue, commonly developed. Stage 2, infection spreads throughout the bloodstream and lymph nodes. Rashes may erupt in other places. If infection affects the nervous system, most often causes weakness or paralysis in the nerves of the face or spine. Untreated infection can occur after a few weeks or months, leading to prolonged bouts of arthritis and neurological problems.
Lyme's disease is caused by a spirochete bacteria called Borrelia burgdorferi. The steps leading to the human contracting the virus: first, the tick will feed off of a white-footed mouse, which usually has the Borrelia burgdorferi bacteria, and Lyme's disease is also known as a zoonotic disease. The infected tick or vector will then go through its life stages. During the nymphal stage, the tick will attach to other animals, including humans. The tick may feed off of the host for several days, spreading the bacteria through their saliva. The human or animal now has the bacteria in the blood, and it spreads, causing Lyme disease symptoms.
Borrelia burgdorferi is a gram-negative, helical-shaped bacterium. The type of bacteria it is a spirochete, which is a long, thin, and spiral-shaped bacteria. It spreads throughout the body, affecting the brain, heart, and joints. The picture below shows a Borrelia burgdorferi bacterium.
The Borrelia burgdorferi bacterium can spread throughout the entire body, not just one system. Also, when the Borrelia burgdorferi bacterium invades an organ, not many bacterium invade the organ. However, the immune response to this bacteria is what's detrimental to our bodies, because the immune response kills the bacteria all the while damaging the tissue. Some main examples of this bacterium destroying tissues is the spread of bacteria to the heart. This is also called carditis. The main way that the heart is affected in this is the atrioventricular node is affected, causing the heart to slow down beats. In addition, the spread of the bacteria to the brain and nerves is called meningitis and can cause Bell's palsy, or slowing down of the nerves in the face. Finally, the spread of bacteria to the joints can cause arthritis and inflammation of joints. The immune system tries to combat the bacteria by releasing antibodies and white blood cells. However, this can kill the tissue and damage it, causing fever and malaise. In addition, the digestive system can become irritated, and this is why Gary was experiencing flu-like symptoms.
Lyme disease was first diagnosed in Lyme, Connecticut during an outbreak of arthritic patients, most common in Northeast and Midwest in the USA. Many parts of Asia and European countries are some of the other places that it is prevalent. Around 30,000 cases each year are diagnosed, but none of these cases are necessarily in the area that Gary lives because they are in other regions.
To test for Lyme disease, an enzyme-linked immunosorbent assay test is performed to determine if there are Borrelia burgdorferi antibodies in the blood, which is also called an ELISA test. If the ELISA test is positive, a Western blot test is needed to confirm the diagnosis. Gary also received diagnostic tests before the diagnosis of Lyme disease, which included an MRI, blood pressure, heart rate, and temperature. Treatments for Lyme disease include oral antibiotics such as doxycycline and cefirocime, which slow down the bacterial growth, which ultimately kills off the bacteria. In addition to this, intravenous antibiotics are used when the disease has already progressed into later stages, which can be quite effective.
Throughout Gary's case, there are many biomedical professionals involved. One main biomedical professional is a general physician. General physicians are highly trained and have their medical degree. They also provide care to adults and are non-surgical, which means they're used in clinics. In this case, the general physician was Dr. Rodriguez. In addition, a registered nurse was used during Gary's case. A registered nurse is a licensed caregiver for patients in the hospital. Their roles include administering medication, keeping the patient comfortable, and providing necessary supplies for the patient. In addition, Gary's case used a radiologist when he was taking an MRI of his knees. Radiologists take x-rays and perform tests that involve the use of radiological equipment, usually coincide working with the prescribing doctor to perform tests. Finally, a phlebotomist was used during Gary's case. A phlebotomist draws blood, ensuring that it is labeled correctly and taking care of the equipment used in the laboratory. In Gary's case, a phlebotomist performed an ELISA test as well as a Western blot test.